Good evening, everyone. Welcome, Menopause Wellness Community. How are you doing this evening? I hope you're all doing well. And yeah, just come in and say hi. Join in the conversations. Hi. Hi, Johnny. Hi, Jessie. Casa, welcome to the Menopause Wellness Community. I'm glad you're here this evening. So we're going to be talking, what are we going to be talking about today? We are actually going to be talking about menopause and teeth. How does the menopause impact your teeth? Well, we're going through a whole series of the body. We talked about menopause and breasts. We talked about menopause. We're going to be talking about menopause in the heart as well. We're going to be talking about menopause in the eyes. How it's just interesting how the menopause can impact every single part of the body. So we're going to be talking today about menopause and your teeth. So welcome. So you are with the Menopause Wellness Community. If you are interested in this subject, then feel free to stick around, let your friends know. And we meet up every Tuesday, Thursday and Sunday at 8 p.m. British Summer Time. Just for 1 hour, mind you, just for 1 hour. And we have recently started trialling menopause drop-in. And that was done last week, actually. So we may be doing another one. We're just going to see how everyone was, the feedback from that. But yeah, how is everyone? Let me know where you're from. If you're new to the community as well, if you've come across the community before. But yeah, let me know where you are from. Welcome. So I'm going to get started in a little while. Hey Claire, how are you? Claire is one of our community ambassadors. We have 5 community ambassadors. Thank you for the roses. We have 5 community ambassadors and I've got to big them up. I've got to shout them out. A big shout out to Claire, Samantha, Lulu, Just Empress, and also Poetic Angel. They are my queens, I'm telling you. Absolutely. So we're going to get, I feel a bit relaxed today. I've just been doing a lot of admin today. I went for a 2-hour walk this morning and then I started off with my admin and I didn't finish until after 6 this evening, so it was a lot of work I had to do. But I hope everyone's had a productive day. So I've got my notes here as always, because you know the brain fog is real, right? The brain fog is absolutely real. Yes, and so without that happening, I'm going to have my notes here. Thank you for all the likes. Thank you for the likes. Do share the live with a friend if you feel your friend is going to be interested in it. So we're going to have a look at how the menopause can impact teeth, right? Do you remember on the last time I was on, actually, I think it may have been the menopause drop-in, or the time before that. I was talking about how I've just recently experiencing it. Only happened the once, mind you. I've started experiencing bleeding gums and I've never had that before. Hi Lynn, how are you? Thank you for the gifts. Hi Roxy, hi Liz, Lady V, Alison, London 12. Welcome. So we're going to get going about talking about the menopause in the teeth. If anyone's noticed the community page, you would have seen that we've got a theme going, right? So we're going to be covering all parts of the body and how the menopause can have an impact on it. So I'm going to just talk about how menopause can impact on teeth, okay? So we know that the menopause is... Hi! How are you? How is everyone doing? Okay. So We're going to talk. So what happens to hormones during the menopause? Okay, this is about the teeth now. So we know that the estrogen, however you wish to pronounce it, okay, estrogen levels will start declining. They start to fluctuate and then they will start declining eventually. Okay, so by the time you get to postmenopause, they start to stabilize. Okay, so because of the decreased estrogen, this can lead to bone density. We're aware of that. It leads to bone density, affecting teeth support. So with your teeth, okay, you can start experiencing dry mouth. We talked about that. That comes up as one of the symptoms. It's an uncommon symptom, but it does come up. So the dry mouth, so because the saliva's become reduced, the flow of saliva has been reduced. So therefore, we can experience more bacteria. We can experience bad breath, decay. It doesn't mean that because I'm reading this out, it doesn't mean that that's what's going to happen. This is what can happen. So this is why it's really important to then just give that extra vigilant and look after your teeth even more so. Okay, so these are all the things it can cause. So gum sensitivity and inflammation also is linked to hormone changes as well. There are times, actually, I remember there are times when during the day when I feel that my gums feels a bit swollen, just inflammation, right? These hormones, we don't realize just how important they are. And when they start fluctuating and declining, a lot of things can be going on for us. And so, yeah, burning mouth syndrome. Okay, some women feel tingling or burning sensations in the mouth. Again, this is through the decline in the estrogen. Changes in taste. I was speaking about this the other day. Our taste buds can start changing. So you could be eating a certain type of food in this week, and in a month's time, you cannot you don't like it anymore. Your body can change. We're going to be also talking about the digestive system. This is another one. I don't want to go into too much about the tasting and change because we're going to talk about the digestive systems. So if you notice bleeding gums or increased sensitivity since the menopause, if anyone's noticed any bleeding gums or increased sensitivity, just let me know in the chat. And what have you been doing about it? I mean, one of the things is that you can go to the dentist, but you're going to have to mention to the dentist. I know I've been to the dentist and I've always said my teeth, I've got strong teeth, but I've also lost a tooth as well. I noticed that since the menopause or post-menopause, my teeth, I have to be mindful about what I eat because my teeth break easily, very easily. So yeah, that's one of the things. Hi Wendy. My own health is embarrassing. It smells like, oh, that's not good. Have you been to the dentist? Sorry to hear that. Have you been to the dentist, Wendy? I'm sure you would have gone to the dentist. But go and have a chat with your dentist. You can go and see the GP. The GP will probably recommend you to go and see the dentist as well. So all this can be occurring. So what else is going to can actually take place? So because of our decreased estrogen, it can lead to like bone density, as I mentioned, and affecting the teeth. I have, but it hasn't helped. Okay. Have they recommended anything for you? Because I would hope that the dentist would recommend something for you. Or maybe speak to the pharmacist as well to see what the pharmacist says. It's really upsetting when you go to see these health professionals and they don't veer you in the right direction and you're still, trying to navigate through the symptoms that you're experiencing. You have to kind of put your foot down with them sometimes. So we're going to go on to, we talked about the changes. the importance of dental checkups. We know that we have to have dental checkups. Well, every 6 months. The 6 months go around so quickly, don't they? I'm overdue my dental checkup actually. But yeah, I was saying the other day that my dental checkups are like £50. And that's without x-rays. That's absolutely without x-rays. So, hi Moonshine, how are you? This is the thing. Dentists are so expensive. Yeah, that's a lot of money, and it gets to the stage where you feel to yourself, can you justify it? Yeah, and I hear you. I've been told by my dentist, why don't you get this tooth put? Why don't you get an implant in here? How much is an implant? £2,000. What? £2,000 for one tooth? No, it's okay. I'll just leave it as it is. And then I was suggested to have a bridge, not a bridge, a denture fitted there. Again, even that was £700 and something. Nah, it's a lot of money. I think in this day and age, you have to sit there and think, can I justify paying that money? To me, it didn't make any sense at all. Nafisa, I'm hoping I'm pronouncing your name correctly. Pregnancy tooth problems. Oh, yes, that can happen as well. It's all about the hormones, isn't it? Absolutely all about the hormones. They're all over the place during pregnancy, and they're all over the place during menopause as well. So we're going to take, what tips have you got to look after your teeth? What are you doing? Put it in the chat, that what are you doing to look after your teeth, particularly whilst you are navigating through the menopause? And even like Nafisa, what were you doing to look after your teeth during pregnancy as well? Let us know. Oh, don't you not get 6 months checkup? And this is the thing with dentists. It's easy to, well, no, it's not. I shouldn't say it's easy. If you join a dental practice and you sign up as an NHS patient, your costs are lowered significantly. But I just cannot, for some reason, I've done my research, there are no dental practice in my area that are taking on NHS patients. So you have to, I had to go private, and I'm stuck in that loop. Yeah, let me know what you're doing to look after your teeth. What can I take for hair loss? Savvy, hi, how are you? It's different things. Are you thinning in the hair, or we're going to talk about menopause and hair as well, actually. I think it's next week or the week after. But there's what I done for my hair. My hair was thinning, and I used some hair products that this lady called Aqua, she came on and spoke about hair health and hair loss. And she makes this hair oil called Rise. And it's got things like hibiscus and lavender in there. So it's more maybe natural things that you could use in your hair. And what I love about this hair oil is it's for any type of hair. It is absolutely for any type of hair. And so as my hair felt really thin, I purchased it and I used it for 2 months. Now, I was consistent in using it every single day. Actually, sometimes I use it twice a day, but every single day, no fail, I used it on my scalp. And after 2 months, my hair was a lot thicker. It was a lot thicker. You may want to, if you have got a YouTube account, you may want to catch up on that live. All the lives are uploaded on our YouTube channel, so you can have a listen to it. Okay. Fran, hi Fran, how are you? Welcome to the community. My teeth are so bad now since menopause. Fran, I hear you. I hear you and understand you. It is all about the declining estrogen, and that's what can happen. Well, I just mentioned, I'm not sure how long you've been in the live, mentioned about it having an impact. You can get bad breath, you can get bleeding gums, inflammation. There's so many things that can happen to our teeth during the menopause. I'm going to go through some more information. I'm just going to check any comments. I have no means even on NHS. Wow. Do you know what? I'm just thinking, Moonshine, I'm going to find out some information. I don't know if your DMs are opened. Let me know if your DMs are opened, and I'm going to find out some information for you and send it over to you this evening. I'm going to do some research because I'm thinking if it's still there, but I don't want to say it just in case. I'm going to find out some research for you, and I'm going to be in touch with you, okay? Let me see. I get a lot of ulcers. Oh, gosh, Claire, yeah, ulcers are horrible. Ulcers are absolutely horrible. C. Taylor, how are you? Good evening. Yeah, ulcers are not nice. You're welcome, Moonshine. I'm gonna speak to you outside of this live. Definitely speak to you outside of this live. Hey Alice, how are you? So we're gonna talk about. I'm gonna just go through some information that I've got here. So we talked about dental checkups. We can do the checkups every 6 months. Although it goes so quickly. I get ulcers on my tongue. Oh my goodness, yeah. On the tongue. And I'm going to go back to, you're probably going to be so fed up of me saying this. I'm going to go back to nutrition as well. We have to be mindful about what we are eating as well. Yes, our declining estrogen is a main contributing factor. But we have to be mindful about what we're eating as well. Good to hear, C. Taylor. Good to hear. Yeah, ulcers in the mouth is not nice. What do you use for ulcers in the mouth? Are you still using the Bonjela, or are you using something else? I've forgotten what's supposed to be good for ulcers in the mouth. Isn't it? Is it clove? No, that's for teeth. Clove. The clove is for teeth, isn't it? Welcome to the live, everyone. We're just having I'm just going through some information about menopause and the teeth, how the menopause impacts the teeth. So I'm going to come back to the questions and comments in a little while. So we talked about checkups, dental checkups, that regular checkups, regular dental check visits help spot early changes. Now, I would say, because I've had to say to my dentist a few times that I'm navigating through the menopause, and I don't even think my dentist listened to me, to be honest with you. So, maybe they just think I'm just not looking after my teeth. But yeah, do let your dentist know that you are navigating through the menopause. So just some practical tips to navigate the menopause and oral health. Okay. So Hi Claudette, how are you? I'll come back to this in a minute. I'm trying to do two things at the same time. Stay hydrated. Okay, it's really important to stay hydrated. Sip water often. Chew, if you're going to chew chewing gum, sugar-free gum, okay, to stimulate saliva. Remember, because of the decline in the estrogen, we've got less saliva. So by chewing the sugar-free gum, it helps to stimulate saliva. Balanced diet. I said to you, I was going to come back to food, didn't I? Balanced diet, calcium, vitamin C, magnesium for bone and tooth strength. So these are the things what we've got to be considering as well, okay? Oral hygiene, gentle, fluoride toothpaste, soft bristles, brush. It's really important though as well, because I used to have a hard bristle. I quite used to like firm bristle, but it's not good, the firm bristles on your teeth as well. So soft bristles is going to be suggested rather than the hard bristles. And flossing. Who flosses? Does anyone floss? I always floss. Does anyone floss? Hey, hot water, how are you? So flossing helps as well. So again, I'm going to say it, limit alcohol and caffeine. They can worsen dry mouth, right? They can worsen dry mouth. And if you're used to drinking alcohol and caffeine and you think, well, I'm not getting dry mouth, then that's all right. But these things can happen. Remember I said, because I'm going through menopause and teeth, it doesn't mean that everyone's going to experience this. Okay, so that's going to try and limit the alcohol, limit the caffeine, regular dental checkups, like I mentioned, about every 6 months, or more frequent if symptoms persist, because sometimes you have to go more often. Ask about saliva substitutes or fluoride mouth rinses. Again, some people will use mouthwashes as well, but just be mindful about which ones you use. Speak to your dentist about it, or even, if not the dentist, the pharmacist. Go into your chemist and speak to the pharmacist. Smoking. Smoking, it worsens gum and bone loss. That's what it can do. I did mention about the smoking. It reduces your blood, your circulation, your blood vessels. Yeah. So think about emotional and self-care. So oral health is part of overall well-being. And this is why we're having a themed, for the next few weeks, we're going to have a theme around the menopause and parts of the body. We've got menopause and eyes. We've got menopause and heart health coming up. We have menopause and the digestive system, just so we can understand a bit more how the menopause is impacting all this going on in our bodies. Okay. So, if anyone's got any questions around the menopause, I know I was just talking briefly about menopause and the teeth today. If anyone's got any questions, anyone wants to come up and have a chat, let me know. I will open up the platform to see if anyone would like to come up. Hi, Eden. Aids Kitchen. Hi, Mary. Alice, thank you for sharing the live. Sidim, how are you? I haven't seen you for a while. Welcome back. The only way. Yeah. Does it say about yellowing teeth, Jackie? No. Why is that what you... It doesn't say about that. I will check, because your teeth, because of the lack of estrogen, it could well happen. But again, that could be due to what we're eating as well. Are we supposed to take estrogen supplements? Melanie, hi, how are you? You can speak to your pharmacist or your GP about that. You don't have to. It all depends on what is going to work for you. Mine are terrible. I'm going to check, because I've not come across any information about that. We could have got a dentist in there. We got a dentist in the community. Have we got a dentist in the community? Let me check. Okay. Right. So, Claire, this is what it's coming up with. Okay. Yellowing teeth during menopause can be caused by reduced saliva, hormonal changes affecting enamel, and lifestyle factors. So again, it's a combination of, yes, it's the hormones, but it's also lifestyle factors as well. So it's a combination of food as well. Have you gone to see the dentist about it? See what they suggest. So remember, the menopause leads to decreased estrogen, okay, which can then cause the dry mouth, and our mouth needs saliva. And if we've got lack of saliva, it can lead to lots of different things. The decay, gum disease. So we have to think about what we are nourishing our bodies with. I'm always going to keep going back to food. Do you know what? All this information and research, a lot of it will always have, what are you eating? The foods that we are eating. Yeah. I'm just going to say, hi, Bless. How are you? Good to see you. Good to hear that you are good, Melanie. Hot water, how are you? Well, I'm going to open up the chat. I'm going to open up the chat if anyone wants to come up and talk. I'm going to have to go to Turkey then, Jack. Oh my gosh. Do you know what, Claire? Do what you need to do, isn't it? I'm telling you. I don't know. I'm too afraid for that. One of my friends did that, and oh my gosh, no. I felt the pain. I couldn't. And I wasn't even there. It wasn't even me getting it done. No, I can't do it. But if you want to do it, go for it. Go for it. Okay, I'm going to open up this chat. I'm going to open up the chat. Let me open up. Do you know what? This isn't letting me open up this chat. No, it's not. I don't know why it's not letting me open up the chat. And I noticed that the last time when I tried to... No. They've disconnected that. Can't open up the chat. All right. Well, I don't know why it's been disconnected. Thank you for the follow, everyone. Thank you for the follow. Thank you for the likes. Thank you for the reposts. Thank you for being here. Those of you who don't know me, I'm Jackie. This is the Menopause Wellness Community. We meet up Tuesdays, Thursdays and Sundays where we talk about the menopause and do lots of other things as well. Oh, did I tell everyone? I put it in the on the community page that the event that was going to take place on Monday, our very first face-to-face menopause event, Embracing Menopause, has been postponed until January. And it's going to be on the 24th. It's on a Saturday this time. The Saturday, the 24th of January. Yeah. And it's going to be 2 till 5. So that's going to be our very first face-to-face menopause event. So we've just postponed it for Monday. There was low numbers, and I just thought it may have been something to do with half term. There were some schools that have broken up this week, and some schools are finishing next week for half term. So yeah, we're gonna that's been rescheduled for January now. Which city in London? Alice, which city in London? What, the event? Sid Cup. Jane Less. Hi, welcome. Okay, would I recommend HRT? Jane Less, I'm going to be honest with you. I'm not a HRT girly. And there are people in the community that are on HRT and it is working fantastically for them. And there are some people in the community that HRT has not worked for them. And they've had a rough time with it. HRT, you don't know if it's going to work for you until you try it. And this is the thing. One size doesn't fit all. So in order for you to know if it's going to work, speak to your GP. Find out what they're recommending, because there's gels, there's patches, there's sprays, and find out what the benefits are. Do the benefits outweigh the risks? Okay. I've just never wanted to go on HRT because I just felt that the risks that it was presenting, I wasn't prepared to take the risk on myself. So yeah, I've just never taken it. So I cannot directly say to you, oh yeah, Jane, go and take it. Yeah, maybe as well speak to some of the ladies in the community about HRT, but I feel that you will have to make that decision yourself. Absolutely, make that decision yourself. I know, I am aware that GPs will recommend that you use it for 3 months. Give it 3 months before you kind of like throw the towel in on it. But yeah, it's whatever you feel is right for yourself. A lot of people want to go with natural. There's many women on HRT as well. Let me just see if I've missed any comments. Thank you for the likes. Thank you for the shares. Let me see. Jane is on the. He is on the gels at the moment, but we are waiting for bloods. But okay. You're welcome. You're welcome. Oh, he's saying gels. I've heard that the gels work well from the women who are using it. But yeah, I'm not a big fan of it, to be honest with you. I prefer the natural route, me. Hi, Alice. Do some research. Read about it before you. Absolutely, Alice. Yeah. I would always say do your due diligence on things. Do your own research. Ask the right questions when you go to the GP, because if we're not asking the right questions, a lot of the time the information isn't necessarily given up to us. Okay, voluntarily given up to us unless we ask the right questions. I keep saying, and I'm going to always say, we need to be better advocates for ourselves. When we go to see GPs and consultants and they say, you need to be taking this, you need to be taking that, we sometimes turn around and say, okay, well, no. Why do I need to be taking it? Why are you giving it to me? What are the benefits of giving that to me? And what are the risks? We need to ask these questions. Okay? You're welcome, Jane Les. You're welcome. Let me see. Yeah, I don't know why I cannot open up the chat. It's not letting me. I don't know. Maybe I said something and they've just stopped me from opening up the chat, right? I don't know how this works. I really don't know how this works. Yeah, as well. I've updated the supplement list as well. That has been sent out today to whoever wanted the supplements list. I finished it and it's been sent out now, so you should have it in your email. And there are some of you that have not responded back to me to let me know which lists you would like. Okay, Sims, good evening. Good evening. How are you, Sims, today? I've got a dry mouth. I should have carried my water upstairs. Yes. And if anyone's got any if anyone's got any subject matters that they would like to discuss on a live, let me know. For the next week and a bit, we've got things scheduled. We've got the next live is going to be menopause and the heart. We're going to talk about that, how it impacts the heart. We're going to talk about hair. Supplement list, please. C. Taylor, yes. Can you I will send it to you. I think I've sent you some information before, haven't I? Correct me if I'm wrong. I'm sure I've sent you some information before, so I will have your email. Yeah, I'll send over the supplement list to you. If anyone needs any, yes. Okay, I'll send that over when I finish. I'll send over the supplement list for you. So if anyone needs any lists, let me know and I will send them over. You're welcome. You're welcome. You are welcome. So how is everyone doing on their menopause journey? How are you, how are you feeling at the moment? I know it isn't great. If we could have a magic wand and say, would you rather the menopause go away or would you keep it? Absolutely, we would probably say we want it to go away, right? How is everyone coping? Yeah, I hope everyone's had a great day today. Thank you, Panther. I hope everyone's had a great day today as well. Thank you for the follow. So if you are Law, how are you? Welcome, welcome. Hi there. I wanted to know if there's any good suppositories for dryness. There are going to be suppositories. Are you talking about downstairs dryness? I'm presuming. Correct me if I'm wrong, Law. Downstairs dryness are you talking about? Clean your lens. Oh, is my lens dirty? Hold on a sec. Thanks, Sophia. Is that better? Is that better? Welcome to the live. Welcome to the live. I heard of constantly. Okay. And if you've heard about it, again, check it out. Do some research on it. You know, I'm sure you'll be able to find some reviews about it as well. I'm presuming you're talking about dryness downstairs, right? Someone recommended gel. I think the gel's called Yes, YES. Again, I've not used it, but someone recommended it. I remember that someone recommended it to me in the community. Good doctor. Welcome, welcome. Welcome, Jenny. Welcome, Joanne. Get the Yes cream, Jackie. Do you know what? I don't have a problem with it at the moment. It was someone recommended the Yes cream because I was saying about the vaginal itching. But then my avocados got rid of my vaginal itching, didn't it? Totally got rid of it. And you see, the moment I don't eat avocados for about 2-3 days, the itching starts creeping back in. So I'm back on the avocados. Oh, it was you. Oh, it was you, Claire. Yes. I didn't have to get it because of the avocados helped. Avocado, totally gone. Itching's totally gone. You're welcome, Law. Get the Yes cream. Yeah, no, I don't need it at the moment. I'm okay now. Yes, I'm telling you, this journey is, yeah, it can be hard. It can be hard. Absolutely hard. Hi, Lynn. How are you? Welcome, welcome. I'm sad that I can't open up the chat. It's nice to hear people's voices when we're on here. And I cannot open up the chat. I don't know why. I must find out why it's not allowing me to open up the chat. Can you send an invite to me? But hold on a minute. I can see invites here. Hold on a sec. Let me see. I've sent an invite. Let me see if it opens up a chat. I only want to just see if it opens up a chat. Because it's not allowing me to open up the platform for some reason. I don't know what's going on. I wonder why, Jack. I don't know. Claire, I'm going to send you... Can you send me an invite? I don't know. We must have done something wrong. Why? I don't know. I'll have to check it out. Why I cannot open up the chart. Thank you for the follow. Thank you for the follow. So yeah, if anyone has any questions, feel free to pop it in the chat. And if you're thinking, oh, I don't really want to pop my question in the chat, then you can just reach out to me and you can send me your question either via DM or click on the email link on the page and you can send me your message via email. So yes, those of you who don't know who I am, I'm Jackie. I am a menopause wellness practitioner as well as a menopause nutrition and weight loss management practitioner. And the community's here. We meet 3 evenings a week just for an hour. And the community is here as a safe space to be heard and understood whilst you are navigating through your menopause journey. It could be that you are about to embark on your menopause and you want to know more about menopause, then this is the place to be. If you are part of the community, you know how we operate here. If you are not part of the community and you'd like to be part of the community, all you have to do is click the follow link. Yeah. See, Taylor, you came up. Hey.
I didn't mean to.
No, that's fine. That is absolutely fine. I'm glad because it wouldn't allow me to add someone as a guest. So that's why I was just randomly sending out invites. How are you?
Okay. I'm well, thank you.
Good, good, good. I will send you the supplement list this evening, okay?
Okay, thanks.
Yeah, you're
Can you take me
welcome.
down back,
I
please?
will. I'll put you back down. Thank you.
Yeah, thank you.
Okay. So it is working. I don't know what's going on. So maybe I'm not opening the chat. Maybe I just have to invite. Maybe it wasn't anything that I done or anyone else done. Jelly bean and gone. Jelly bean. Sorry, these creative names, they get me. Any advice on engaging with my employer about adjustments at work? Okay, Jelly bean. I'm going to call you Jelly. Jelly bean and gone, you know. Um, I'm going to if you have you spoken to your employer already as well. I don't know if you know about the updated employment law. It does include menopause as well. So as of 2026, next year, if your employer has more than 250 employees, they will need to publish a menopause policy. They will need to publish one. If they're less than 250, then they're going to be able to access information around how they can support. Now, this reasonable adjustment, and a reasonable adjustment is going to be different for every workplace. What I would say to you is go and speak to your line manager first and foremost, if you haven't done already, and just let them know, ask them, do they know about the changes around the menopause support in the workplace? And have that conversation. Your conversation will need to be supportive. It needs to be a conversation that doesn't feel embarrassing, doesn't feel like it's got any stigma attached to it. I'm happy to send you some information around so you can go armed with information. So please feel free to reach out to me, Jelly. Feel free to reach out to me and I can send you over some information. And so you can go to your go to your employer and give them some information about this new change. Yeah. And that may get the conversation started, right? You just may need that nugget to get the conversation started. But it needs to be, supportive to you. Do you have, are there quite a few women navigating through the menopause at your work, like your place of work? Because there's sometimes that, if you're the only female in your workplace, not that matters, because it still needs to have the conversation, still needs to be had. But yeah, I'm happy to send some information so you can go armed to your. I went to open up a conversation. I hope they will be positive. We are less than 250 employees. Okay. So if you're less than 250 employees, then they are not going to be required to publish their menopause policies. However, the law is now going to be on our side. So we can actually have conversations with our employers, because remember, if you are having a conversation with your employer and you are letting them know that you are finding it challenging, things like concentration, the brain fog. And if your working environment is not conducive to support you, then that's not them doing what they need to do. They're going to have to, not like they're going to have to, they're going to need to look at making reasonable adjustments. Absolutely going to need to make reasonable adjustments. Hey, Just Empress is in the house. So Jelly, what I'm going to do, I'm going to reach out to you as well. Let me know if your DMs are open. If they're not open, then please email me. I'm going to email you some information to bring to your employer. I'm the only one in the area and line manager is a man. I hope I can articulate. I'll give you some information. I will absolutely give you some information. And we do. And, I've even got information for men and menopause. Not that men are having the menopause, just so they can understand. And we do workshops around it as well. So I will give you some information to give to your employer, your manager. Okay? And that man, he may well have a wife. He may well have a sister, a niece that is navigating through menopause or about to embark on menopause. So yeah, I'll support you around getting the information to your employer. Okay? Could I have it sent, please? On and off the rails. Oh my goodness. Where do you get these names from? Where do you get these names from? So on and off the rails. What is it that you would like? The employer information or the lists? I will send you whatever you need sent in terms of information. But you just need to let me know. DM me. If you cannot DM me, if your DMs are not open, just go onto the page, the community page, and click on the email link and you can send the email directly to me. Okay? So that's linked up to the Menopause Wellness community email. Thank you, Panther. Thank you for the heart me. Sassy Joe. These names, I tell you. I work on our supported living and I'm the oldest of... why does that happen when I do that? Oldest of right now, not needs. Okay. No, sorry, I just muted. Okay. Sassy Joe. Is it Sassy Joe? Okay. I will I'm happy to share some information with you as well. And you know what? One of the it can be a challenge to go and speak to your managers about it, particularly if you feel that they're not going to give you the time of the day, and particularly if you feel that they're not even going to listen. And I can give you some support around just being armed with information to take to your managers. Okay, so I'll definitely get that across to you. And please, if I haven't messaged you, send me a message, please, and I'll get back to you. I will get back to you. But you see, this brain fog is real. By the time I get off here this evening, I'm just remembering I've got to send something to C Taylor. I've got to send something to C Taylor. I'll probably be messaging you saying, remind me what it is. I'll inbox you. Thank you. Thank you very much. Yeah, inbox me and I'll get back to you for sure. Yeah, we really need to speak to our line managers, anyone, HR even. They need to... Thank you, Paula. And sometimes they're not aware. This is the thing. This is what I'm saying about going armed with information. So if I'm giving you the information, you can actually start the conversation or even just leave it on the desk to say, look, I've got some information about the employment law that's been updated in October. And That was October 2024, mind you. And as of 2026, this is going to be happening. No, we don't have 250 employees here. However, this is the support that I feel I need. Okay, because that's what we need to do when we're being an advocate for ourselves. We need to be explicit in how we explain. So rather than saying, oh, I'm going through the menopause, actually pinpoint whilst I'm at work, because of the environment, I get a lot of hot flushes, or I am experiencing brain fog, and the heat is exasperating my brain fog. So I am not, I'm finding completing my tasks a challenge. This is what we need to do. Be explicit in when we're explaining things. I was struggling so much in work and I felt embarrassed, but okay. No, it's good thing. It's the good thing you did that. Point I made about my brain. And this is the thing. We have to. Do you know what? When we are talking about our menopause and our experience and our symptoms, we shouldn't be downplaying our symptoms, because they are very real, the symptoms. So we shouldn't be saying, oh, I've lack of concentration, but I'll be okay. No, you're not going to be okay. Because if the support is not there, you're not going to be okay. So we have to, be honest and open about what we're experiencing. This brain fog is so heavily, it's so heavy that I cannot concentrate on what I'm doing. I get distracted easily. So this is what we need to be honest and open about. That's an example that I've given you, yeah? Okay, Sassy Joe, I will look out for your message. I'm still in my 6-month probationary and scared stiff if I lose my... No, Sassy Joe. No, that can't happen. They cannot. If they was to sack you because of your menopause, you can take them to the cleaners for that. And this is the thing about the new law. Okay, it's out already. Employers cannot do that. They cannot do that. Yes, thank you, Claire. Thank you. Any information on weight loss, especially waistline? I am mindful of my diet, but no improvement. Okay, C. Taylor. What I would suggest is you consider. You said that you're mindful about what you're eating, and this is again our estrogen, progesterone. You notice I said it's slow. That is declining, and a lot of the time it will show in our stomach, around our stomach, the midriff, right, area. What I would suggest is, I know you said you are mindful about your diet. Have you done a food diary before? Have you done a food diary? Because the reason why I ask is because a lot of the time when we are life is busy, right? You've got your house to run, you've got your household to run, you've got children maybe to look after, maybe parents, work, life. Okay, life is lifing. And sometimes when that is happening, we just grab and go, don't we? A lot of the time, we don't actually stop to consider, okay, what am I actually eating? So the reason why I'm asking you if you carried out a food diary is so you can have an overview of what exactly you have eaten over a period of a week, and then identify it from there. As well, when it comes to like you mentioned about you've looked at what you're eating, are you moving as well? Movement, exercises, how frequent are you doing that? So there's lots of factors. How frequent are you exercising, or what you're eating? Remember, I said a couple of days ago, weight loss is all about is 80% our diet and 20% exercise, or 20% movement, shall I say. So yeah, I would say food diary if you haven't done one already. And analyze the food diary. If you're struggling with it, let me know. Send it over to me. I'll give you... No, okay. Do a food diary. Absolutely do a food diary. Try and do a food diary for 7 days. If you cannot manage 7 days, do 5. What I would suggest you to put in the diary, you can pop it in your phone if you like. I would suggest you do is every single thing that passes your lips. If it's a small piece of cake, you need to jot it down. Drinks, whether it's Coke, whether it's water, everything. If you had chewing gum, I know you don't eat chewing gum, but you've got it in your mouth. Chewing gum, everything. Okay. And then analyze it. 7 days full. If you eat 3 times a day and snack, everything. And then have a look at it and see what you think. If you cannot identify something, send it over to me. And then I'll have a look. I'll analyze it for you. Hi, Kelly. Any suggestion with joint and muscle pain? I've been referred to physio. Oh, have you had a frozen shoulder? Yeah, this muscle pain is not a joke. We've got a live coming up, menopause and muscles. It's not a joke. I've got a list of supplements and herbs and spices that I can send over to you. Feel free to reach out to me. And as well, when it comes to our joint and muscle as well, it's really important that we move. The body does not like to keep still for too long, for long periods of time. So therefore, we have to be moving, whether that's walking, whether that's, any form of exercise, riding, bike, swimming, whatever you do, we need to keep moving. Because if we're not moving with all the hormones levels as they start declining, everything will start seizing up. So we got to keep moving. We've literally got 9 minutes. It's just gone. Thank you. Thank you, Just Empress. I beat you to it this evening. I just checked it as well. Just as I checked it, I saw your time come up. Just Empress is a timekeeper, I'm telling you. I'm not sure if it's menopause or my mental health. Okay. Well, you can go and speak to the GP as well if you think it's something else. But it's always best to rule things out because we don't know. And there are going to be some symptoms that you have around your mental well-being and menopause. A lot of them will overlap. But it's always good to rule things out. VK, how are you? You're new to the community. Welcome, welcome. Welcome to the community. So, I'm just trying to catch up with the. Can I, Paula? I can't take HRT. What can I take for flushes, anxiety, gut health, please? Okay, Paula. I have a list. I'm always talking about. I have a list. There's foods that you can be eating that are going to be useful for menopause. There's going to be herbs and spices that are going to be useful for menopause. There's going to be supplements that are going to be useful. I can send you a supplement list. I can send you a food list. I can send you herbs and spices. I've even got nuts that are going to be useful to eat whilst navigating through the menopause. So Paula, if you've got your DMs open, reach out to me. If your DMs are not opened, then feel free to click on the link, the email link, and I will send it over to you this evening. Sims, I get pains in my knees, but always have done. Okay, so Sims, have you gone to see if it's anything else? Because sometimes, with everything, with our muscles and joints and things like that, our cartilage can start wearing away as well. It's always, listen, let's not downplay our symptoms that we're experiencing. Okay? Our bodies give us signs and symptoms for reasons. So when we get those aches and pains, don't just fob it off and think, oh, it'll go away. Check it out. absolutely check it out. Yeah, definitely check it out. Hi, Kerry. Yeah, muscle pain. We're doing, I think it's next week, we're doing a live on menopause and muscle. Going to be going through what happens to the muscles when, or whilst we're navigating the menopause. The next live is the heart. What's going on with our heart? May I please ask if it's possible to test positive for pregnancy, or is it just part? Yes, you can, Nandi. I'm not sure if you want to hear that. You can. Perimenopause, yes, you can fall pregnant. Just speak to Just Empress about that. She's got a menopause baby. She's got a menopause baby. There's lots of women that's got menopause babies. Perimenopause. You can absolutely fall pregnant. Kelly, when is the live for muscle coming up, please? Next week. I've got a whole list of them. Next week it will be. But keep an eye on the page. I always put the information out, and you will see it's always linked to the live, so you can just register. Yeah, it'll be next week. I think I've got about another seven to put on this week, so keep an eye out. Haley, hi, how are you? I started HRT last week, lost my appetite and get dizzy headaches from progesterone. Okay, I'm sorry to hear that. And I've heard that the HRT sometimes will start giving you certain symptoms that were never there before. They had disappeared and they're now back because you're starting to take them. I'm sure your GP will say give it 3 months at least before, but know your body. Know your body. If you feel you cannot, again, I will say someone said that they started taking HRT, not in the community actually. I think it was a post. Someone started taking HRT and they started having demonic thoughts, so they stopped. You have to do what's right for you, Haley. Remember, one size does not fit all. You may have a group of friends that are taking HRT and they say, yeah, it works for us, so it'll be all right for you. No, one size doesn't fit all. Know what's right for you and your body. Our body gives us signals for a reason. And remember, ask your GP, when I start taking this, what am I likely to experience? So you know, okay, you can mentally prepare yourself for it. I had the same feeling sick too. Sorry to hear that. Yeah. And I would say as well, if when you start taking things like HRT, anything, make a note of anything that's changing. Like if you start feeling sick, if you start getting headaches, jot down how long you've been having the headaches and when it started. So you've got that information, armed with the information when you go back to your GP. Day 5, I started getting a headache and it's really intense. It's at the back and it lasts for this long. Everything. Okay, how do I message you? Sassy Joe, DM. If you don't have DM opened, then go onto the page, the community page. There's an email link at the top of the page. Click on the email link and it will open up the email and send an email to me. The Menopause Wellness Community email. Yeah. And I will respond to you. Zoe, how are you? I'm currently struggling. I have endo. Oh, sorry to hear that. I'm currently struggling. I have endo and I think in perimenopause. I'm going. Oh, it feels like you are going insane. I hear you. We hear you. We understand you. Absolutely. Reach out to me and I can send you some information. And also, Zoe, you may want to go and visit our YouTube channel. We had Dr. Barbara on and she spoke about endometriosis and fibroids, and it may be a live you want to go and catch up on. Every live gets uploaded on our YouTube channel, so you can feel free to go and watch them if you've missed them. But welcome to the community. Katia, how are you? Would you like to move in with me. Paula, you going to cook all my dinners for me? Blair. After my hysterectomy, I had to wait 8 weeks before I got back to... Okay, that's a long while though, isn't it? And this is the thing, the hysterectomy will... Sugar, welcome. Hysterectomy will absolutely trigger your menopause if you wasn't in menopause before. And some women said that after having a hysterectomy, whether it's a full or partial, some of the symptoms came back again. Look, it's 9 o'clock already. It's 9 o'clock. It's gone so quickly. Right. For those of you whose questions I've missed or I haven't responded to, I am going to go and check them now and I'll get back to you. Anyone who needs all the lists, please just email me or DM me. That's the only way I'm going to be able to get the list from you. I'm going to answer your questions. If I haven't, I'm going to do it on the one-to-one basis, as long as you've got your DMs open. No, stress cannot cause menopause. Can stress cause menopause symptoms? I suppose you can get some. I'll send you the symptom list. I'll send you the symptom list. I'm going to end the live in 2 ways. The first way, I'm going to send a virtual hug to everyone. The second way, I'm going to let you know, just remind you that you are not alone. You don't have to feel alone. If you feel alone after the live has ended, please please reach out to somebody who you trust, someone who will listen, and someone who will understand you. If not me, someone else. Okay, I'm going to go and answer all your questions now. As long as your DMs are open, I will answer your questions. Everyone, have a lovely evening. I will see you all on the next day. I don't even remember what day it is. I will see you all on Tuesday, okay, when we're going to talk about the menopause and the heart. Stay blessed, everyone. Bye.